Alaikum warahmatullahi wabarakatuh. Good morning, everybody, and have a nice day. This is again Saeed Hussein. This is the third episode out of 13 episode related to the Handbook of COVID-19 Prevention and Treatment. This is done by Professor Tingbo Lang and his team. Thank you very much for him for sharing. Just maybe half an hour, I sent him an email and he replied immediately. I request him to allow me to share his book as a PowerPoint and he gave me green light. Thank you very much again for sharing. So this is their experience and how to they deal and with the COVID 19. They have around 104 with a case of confirmed case of COVID 19. 74 patient was critically or severe case. So this is their scenario, their setting, and no death till they report this book. When they make this book, there is no death, and also no staff infected, and no patient was misdiagnosed. So this is the success case. That's why I want to share with you this case so you can learn lesson from it. Not necessarily you will take it as a whole, but you can take whatever is suitable to your setting. So let us continue, and I want to thank Dr. Amin. He helped me to prepare these slides. And Happy Mother Day today is 21st of March. Let's start the third part. So this is from this book. So I'll go to the third part. I already spoke about all these. So this is done. Let us go to the third part. So in third part, we will cover lot of things related to disinfection. So disinfection of isolation ward area, also disposal procedure for spill COVID blood and fluid, disinfection of COVID-19 related reusable medical device, disinfection procedure for infection fabrics of suspected and confirmed COVID patient, disposal procedure for COVID-19 related medical waste. So let's start. This is from this book. So disinfection procedure for COVID-19 isolation ward area. Disinfection for the floor and wall. Visible pollutants shall be completely removed before disinfection and handled in accordance with disposal procedure of blood and bodily fluid spills. Disinfection the floor and wall with 1000 mg per liter chlorine containing disinfectant through through floor mopping, spraying, or wiping. Make sure the disinfection is conducted for at least 30 minutes. Carry out disinfection 3 times a day and repeat the procedure at any time when there is contamination. Disinfection of object surface. Visible pollutants should be completely removed before disinfection and handled in accordance with disposal procedure of blood and bodily fluid spills. Wipe the surface of objects with 1000 mg per liter chlorine containing disinfectant, or wipe with the effective chlorine. Wait for 30 minutes and then rinse with clean water. Perform disinfection procedure 3 times a day. Repeat at any time when contamination is suspected. Wipe cleaner regions first, then more contaminated region. Start with the clean first. First wipe the object surface that are not frequently touched, and then wipe the object surface that are frequently touched. Once the object surface is wiped clean, replace the used wipe with new one. Air disinfection. Plasma air sterilizer can be used and continuously run for air disinfection in environmental with human activity. If there is no plasma air sterilizer, such use ultraviolet lamp for 1 hour each time. Perform this operation 3 times a day. Disposal of facial matter and sewage. Before being discharged into the municipal drainage system, fecal matter and sewage must be disinfected by treating with chlorine-containing disinfectant. For initial treatment, the active chlorine must be more than 40 mg per liter. Make sure the disinfection time is at least 1.5 hour, 1.5 hour. The concentration of total residual chlorine in the disinfection sewage should be 10 mg per liter. Disposal procedure for spill COVID-19 patient blood fluid. For spill of small volume, less than 10 ml of blood or bloody fluid, you have two options. Option 1, the spill should be covered with chlorine-containing disinfecting wipes containing 5,000 mg per liter effective chlorine and carefully removed. Then, the surface of the object should be wiped twice. Chlorine-containing disinfection wipes containing 500 mg per liter effective chlorine. Option 2, carefully remove the spill with disposable absorbent materials such as gauze, wipes, etc., which have been soaked in 5,000 mg per liter chlorine containing disinfecting solution. For spill of large volume, more than 10 ml of blood and bloody fluid, first place sign to indicate the presence of a spill. Perform disposal procedure according to option 1 or 2 described below. Option 1, absorb the spilled fluid for 30 minutes with clean absorbent towel containing peroxyacetic acid that can absorb up to 1 liter of liquid per towel, and then clean contaminated area after removing the pollutants. Option 2, completely cover the spill with disinfectant powder or bleach powder containing water absorbing ingredient, or completely cover it with disposable water absorbing materials and then pour sufficient amount of 10,000 mg per liter chlorine containing disinfectant onto the water absorbing material, or cover the dry towel which will be subjected to high disinfection. Leave for at least 30 minutes before carefully removing the spill. Disposal procedure for spill COVID-19 patient blood fluid continuation. Fecal material, secretion, vomit, etc. from patient shall be collected onto special container and disinfected for 2 hours by 20,000 mg per liter chlorine containing disinfectant at spill to disinfect ratio 1 to 2. After removing the spills, disinfect the surface of the pollutant environment or objects. The container that hold the contaminants can be soaked and disinfected with 5,000 mg per liter active chlorine containing disinfectant for 30 minutes and then cleaned. The collected pollutants should be disposed of as a medical waste. The used item should be put into double-layer medical waste bag and disposed as a medical waste. In this diagram, it shows you how disinfection of COVID-19 related reusable medical device. Disinfection of powered air purifying respirator. So powered air purifying respirator, how to deal with the hood, with the motor and strap, with the battery service, with the particulate filter box, breathing tube. So how to deal with each one. In these three, we will deal with them the same, but here be careful, do not detach the filter box. So you need to repeatedly wipe them with 1000 mg per liter chlorine containing disinfectant and let the disinfectant work for 30 minutes. Wipe all part repeatedly and even by with a soft cloth dipped in clean water. Let part dry and place them in a lock bag for future use. Note, there is few notes here. Do not let liquid enter the main unit air outlet or motor. And in this note, please be careful when wiping the battery contacts located at the bottom of the motor. Do not touch the battery contacts directly. Make sure this part is completely dry before a next use or storage. And here in the note number three, do not touch the filter element when cleaning the outer surface. Replace the filter element accordingly to the product of instruction. For the breathing tube, soak in 1000 milligram per liter chlorine containing disinfectant for 30 minutes. Wash with water, clean water, and continue the same. The note here, the disinfection procedure for protective hood described above are only for reusable protective hood, including disposable protective hood. Disinfection of COVID-19 related reusable medical device, cleaning and disinfection procedure for digestive endoscopy and bronchovibroscopy. Soak the endoscope and reusable valve in 0.23% peroxyacetic acid. Confirm the concentration of disinfectant before use to make sure it will be effective. Connect the perfusion line of each channel of the endoscope. Inject 0.23 peroxyacetic acid liquid into line with 50 ml syringe until fully filled and wait for 5 minutes. Detach the perfusion line and wash each cavity and valve of endoscope with disposable special cleaning brush. Put the valve into ultrasound sonic oscillator containing enzyme to oscillate it. Connect the perfusion line of each channel with endoscope. Inject 0.23 peroxyacetic acid into the line with 50 ml syringe and flash the line continuously for 5 minutes. Inject air to dry it for 1 minute. Inject clean water into the line with 50 ml syringe and flash line with continuously for 3 minutes. Inject air to dry it for 1 minute. Perform a leakage test on the endoscope. Put in an automatic endoscopic washing and disinfection machine. Set a high level of disinfection for treatment. Send the device to disinfection supply center to undergo sterilization and ethylene oxide. Disinfection of COVID-related reusable medical continuation. Pre-treatment of the other reusable medical device. If there are no visible pollutant, soak the device in 1000 milligram per liter chlorine containing disinfectant for at least 30 minutes. If there are any visible pollutants, soak the device in 5000 milligram per liter chlorine containing disinfectant for at least 30 minutes. After drying, back and fully enclose the device and send them to disinfection supply center. Disinfection procedure for infectious fabrics of suspected or confirmed patient. Infectious fabrics, clothes, bed sheets, bed cover, pillowcase used by patient, ward area bed curtains, floor towels used for the environment cleaning. Collection method. First, pack the fabric into this disposable water-soluble plastic bag and seal the bag with matching cable ties. Then pack this bag into another plastic bag. Seal the bag with cable ties in gooseneck fashion. Finally, pack the plastic bag into a yellow fabric bag and seal the bag with cable ties. Attach special infection label and the department name. Send them the bag to the laundry room. Disinfection procedure for infectious fabric, suspected or confirmed cases. Storage and washing. Infection fabric should be separated from other infectious fabrics, non-COVID-19, and washed in a dedicated washing machine. Wash and disinfect these fabrics with chlorine containing disinfectant at 90 degrees centigrade for at least 30 minutes. Infectious fabrics should be separated from other infectious fabrics, non-COVID, and washed in a dedicated wash machine. Wash and disinfected this fabric with chlorine containing disinfectant at least 90 degree for at least 30 minutes. Disinfection of transport tool. Special transport tool should be used specifically for transporting infection fabric. The tool shall be disinfected immediately each time after being used transporting infection fabric. The transport tool should be wiped with a chlorine-containing disinfectant with 1000 mg per liter active chlorine. Leave disinfectant for 30 minutes before wiping the towels clean with clean water. Now we'll talk about the medical waste, how to dispose them. Disposal or procedure for medical waste for patient with COVID-19 suspected or confirmed. All waste generated from suspected or confirmed patient shall be dispensed as medical waste. Put the medical waste into a double layer medical waste bag. Seal the bag with cable ties and gooseneck fashion and spray the bag with 1000 mg per liter chlorine containing disinfectant. Put sharp objects into a special plastic box. Seal the box and spray the box with 1000 mg per liter chlorine containing disinfectant. Put the bag waste into medical waste transfer box. Attach special infection label. Fully enclose the box and transfer it. Transfer the waste to a temporary storage point for medical waste along with special route at fixed time point and store the waste separately at fixed location. The medical waste shall be collected and disposed of by approved medical waste disposal provider. Thank you very much. And in the next episode, we will talk about procedure for procedures for taking remedial action against occupational exposure. What we have to do in case of occupational exposure of COVID-19. In case of surgical operation, if patient needs surgery, what to do? For if he's a COVID-19 and he needs the surgery, so there is a chance. Number three, procedure for handling bodies. If patient die, if he die COVID, how to deal with him? Then we, last but not least, we will talk about digital support for epidemic prevention. I remind you, this book is consist of three parts. Still, I am in. This is the last episode of. The coming one will be the last one for part one. Then we will go to part two and part three. Thank you very much. Share with as much as you can, and please give me any comment because I am a clinical pharmacist. There is a lot of things it's not out of my area, but we need to learn from each other. Thank you very much, and have a nice day.